Hello everyone, this is Dr. Rashmi Naik. I'm a consultant pediatrician working at Dakshata Lifeline and Lotus Hospitals, Belgaum. As we all know that the present virus predominantly in this wave is Omicron. So we'll discuss a few frequently asked questions regarding Omicron in kids. As we all know, Omicron is a very contagious virus and it is spreading very fast. But the good thing is that it is a very mild virus, and till now what we have seen is it hardly causes any fatal disease. So even though it spreads fast, but the disease is very mild in most cases. So the symptoms in children, what we are seeing most commonly is a very high grade fever for first 2 or 3 days, and cold, sore throat. Most of the symptoms related to upper respiratory tract infection, and after third and fourth day we are seeing a very dry hacking cough, dry irritating cough which lasts for a long time. But in most cases the fever usually subsides by third or fourth day, and most symptoms in 90% of the children subside by the 7th day, and in almost 100% they subside by the 10th day. What we are seeing in the present wave is most infections are related to the upper respiratory tract infections. So sinus infection, headache, a severe body ache, and scratchy throat. So this time we don't need to actually monitor the saturations, or the children are not requiring oxygen or ventilators because there is hardly any chest and lung involvement. Also some children are presenting with vomiting and loose motions. In most cases, only a simple paracetamol is all that is required. Mainly, you have to manage the fever for initial 2 to 3 days, and usually after that the fever subsides. So, a simple paracetamol as and when required, and sponging with lukewarm water. You can use tap water to wipe the whole body for maybe 10 to 15 minutes. And if the fever does not respond to paracetamol, ibuprofen should be enough. For cold and cough, in most cases home remedies like honey, turmeric and ginger are good enough. If the cold is causing nose block, you can use simple saline nasal drops, and for dry cough lozenges are also a good way of relieving the soothing the throat. Plenty of warm water. Avoid anything which will increase the cough, like oily food and nuts, dry fruits, etc. For loose motion and vomiting, again plenty of fluids, maintain hydration, no force feeding, otherwise again the child will vomit, and there will be dehydration. And simple food, fermented food like curds will help for in case of diarrheas, and maybe a probiotic if you have at home. Before giving any medicines, better is to consult your pediatrician. So preventive measures are, we all know, following COVID appropriate behavior. N95 mask is recommended for everyone. Children below 2 years should not use any mask, and any child above 2 years should be using preferably a pediatric N95 mask. In case if anybody is sick at home, you have to assume that it is Omicron, and you have to maintain distance from the sick person. If in case if the mother is breastfeeding the child and mother is positive, then she can continue breastfeeding wearing a N95 mask, and keep sanitizing, maintain social distance. That's the only way how to prevent Omicron. There are no vitamins or any other medications which can prevent a COVID infection. But in case if your immunity is down because of any other illness or any other reason, because of any associated morbidity, then you can take a combination of maybe vitamin C, D and zinc. Same combination can also continue for post-COVID period, because post-COVID also the immunity will be down. So you can continue the same combination later on. So the isolation protocols are a little different this time. If you don't have any symptoms but you turn out to be positive, then you don't need any medicines, and 4 to 5 days of isolation is good enough. In case if you are positive with symptoms, then a 7-day isolation period, 7 day from the start of the first symptom or from the day of your positive test, whichever comes first, that period is enough. You don't have to retest again after the completion of isolation period this time, because sometimes that virus also shows a positive result even up to 1 month after the illness. So if the child is positive and other family members are also positive, then no special care has to be taken. But if the child is positive and rest of the family members are negative, then one family member has to be assigned for the child if the child requires care. If the child is old enough to take care of himself or herself, then the child has to be isolated, and proper sanitization and distance has to be maintained. In case if the child is on breastfeeding, obviously the caretaker will be mother, and she'll have to wear N95 mask and maintain distance from other family members, especially the senior citizens. If the child is not on breastfeeding, then any other family member can be assigned for taking care of the child. Lastly, I would like to say that even though Omicron is spreading like wildfire, it is a very mild disease at present. There are hardly any cases of fatalities, and no long COVID symptoms have been seen till now, though it is little early to comment on that. One good aspect about this whole thing is that children who have got Omicron infection will have antibodies against COVID for at least 3 to 6 months. And hopefully after 3 to 6 months, there will be vaccines for children who are below 15, which will take care of future COVID waves. Thank you.